Here we are with one of the Young Investigator Award winners, Markus. Markus, you are double trained as a nuclear medicine physician and a radiologist. What this double training have brought to your patient care activities?
So for myself, I profited a lot also from the radiology training.
How long did it take you to become a radiologist and a nuclear medicine physician?
In sum, it took me 8 years.
That's a long time. What kept you going?
Yeah, it's a fascinating field, both in clinical routine and research. So this is one of the main motivations that you see in clinical routine, that you have certain problems you can't solve. And if you have the tools, for example, PET-CT imaging or novel ligands, that might solve these problems that occur in clinical routine, this is kind of a great motivation for it.
Did you expect to win this award?
Actually not.
So what is your research about?
This year's abstract is about a novel F18 labeled SSTR ligand cytate, and we extended this new ligand now to meningioma imaging. There are some unmet clinical issues in meningioma imaging in clinical routine, for example, delineation of osseous involvement or the differentiation of scar tissue from tumor recurrence after surgery or radiotherapy. And it's basically integrated into radiotherapy planning, especially for the evaluation of the osseous involvement at the skull base, where MRI has its limitations.
What are your future plans?
I'll stick with PET-CT imaging and hybrid imaging, also with a focus on oncology imaging.
What is your advice for those who are only starting the training, either radiology or nuclear medicine?
I think research without clinical basis is often pointless, and you have to do both things to get the real clinical and relevant questions. And clinical routine without novel things and novel research aspects could be quite boring.
So another example of a nice combination of clinical work and research. This was Inside the EANM 22. Stay tuned.